Well, thank you so much for that nice opening remarks, Jane. I'm so excited to see you guys all here in Ann Arbor, and thank you guys for the folks that are online to join us. I'm going to be talking a little bit today about some of the things that the Coordinating Center has done, and many of the things that you as the UL1 PIs and pilot grantees in the consortium have also done. I should probably figure out how to advance my slides. There we go. Oh yeah, okay. There we go. Right. Multiple options. We always like to start with this, some way of showing just kind of the consortium, because again, I'm going to be talking about a lot of things that the Coordinating Center, did not ourselves do. We kind of, are here to support you, to improve and try to, extend the great work that you guys are doing, again, as UL1s and as pilot projects. So many of you guys remember this picture. We had some great weather last year. I'm glad we're at least getting one day of that today. And so, again, we are 15 UL1 projects, and I believe currently 16 pilot projects as of right now, from 7 institutes and offices at the National Institutes of Health. I believe just about all of you guys know us, but I know that there are a few new members, including some of our new pilot grantees. So again, it's always nice to just kind of provide a little reminder of who the coordinating staff are. You've heard from Maggie already, from me. You'll be seeing Megan and Chloe and Amy around for the next couple of days. Please don't hesitate to stop us if you guys have any questions. So celebrating some of the consortium and coordinating center accomplishments this year, there have been quite a few. So we're going to talk today about data resources. Of course, we're at ICPSR. We have the data folks, so can't help to do that. We're going to talk about the amazing research outputs that you guys have. We're going to update you guys on the newest pilot grantees that we have, and then some awards, accolades, recognitions, and more. So again, we're going to start with the data. That's ICPSR's bread and butter. So we're gonna go with that. So as many of you guys are aware, the UL1 projects have been really active in creating high impact and really useful data resources. This includes things like the National Neighborhood Data Archive, or NANDA, the National Couples Health and Time Study, NCHAT, the National Wellbeing Survey, and many more that we do not have time to list. But also, we also recognize, again, being a large data archive, the really fundamental importance of secondary data analysis. And so we want to, call attention to the important work that researchers are doing in the consortium to develop new measures that are useful, not just for their own studies, but also for, the broader research community. So some things that have recently come out are the occupational social distancing indices from Laura Montenovo at Purdue and Bruce Weinberg at OSU. Some essential work projects from Emily Wiemers at Syracuse, telehealth uptake from the group at South Carolina, vaccine uptake from Dr. Albellen Schwartz, and many, many others. So also the ones that I listed, those are things that you can find currently in our COVID measures archive, which we'll be talking about here in just a little bit. But again, you guys have been developing important measures from other secondary data sources. This includes kind of key ISR, studies like HRS or PSID, but also, from other consortiums, so N3C, Medicare and Medicaid claims data. The list goes on and on. So really want to highlight just the breadth and depth of the work that you guys are doing there. So speaking of the COVID Measures Archive, just as a reminder, we created this and launched it in September of 2023. And in the years since, you can see it's grown quite a bit. So we, started out with, around 7,500 variables and 16 studies from 4 different contributors. Now we're close to 20,000 variables from 40 studies and 11 contributors. So really has kind of exploded in kind of the size and the diversity of studies that are represented and the types of measures that people can access there. We wanted to also kind of show you that the Measures Archive is a little bit of a different archive. We don't just include data. We do include a lot of data, a lot of really nice and important data that I'll talk about, but we also include variable level metadata as well. And so one of the things that really, came out, particularly in 2020, as I'm sure you guys remember, there was kind of a mad dash to, try to collect data on COVID. And so this led to, some understandable duplication, which, creates some problems down the line as far as, harmonization. And so this led us to try to develop this as kind of a tool for researchers where you can compare across studies so that if you're, creating a new survey, you can see what's already been done out there, and if you have, a particular study or particular data set that you want to try to, be, harmonized with or comparable to, this is a good way of being able to compare, variables across multiple studies side by side. And so here you can kind of see the breakdown of our studies with data and with metadata only. You can see kind of our contributors of studies and the types, and then the number of measures. And what's interesting here, and actually before we kind of put these slides together, I did not realize it was, such kind of evenly mixed between, measures from data sources and variable level metadata sources. So again, kind of interesting to see. So since we've launched this, we've started kind of trying to assess how it's being used. And I'll talk about a little bit more of some of the initiatives that we're going to be starting this year to try to make sure that it's working how we intend it, and identify any potential improvements we can make to make it more useful for the broader research community. So here what we have is these are essentially kind of Google Analytics from our site. And these are data downloads. So all of these studies are, data studies that are in the COVID Measures Archive. You can see NANDA, NCHAT, and the National Wellbeing Survey have quite a few downloads. But I also want to say this is not a dig at the studies that are much smaller. There are a number of things that contribute to this. So most of those are actually much more recent studies. And so they haven't had the same amount of time, whereas NANDA, NCHAT, and the National Wellbeing Survey were some of the first that we added. So with that, you can see that we've had, nearly 5,000 unique downloads, so unique users to download these data. So quite a bit of engagement with these studies. The other thing that I want to mention again that kind of skews these results a little bit is that the NANDA, NCHAT, and National Wellbeing Survey are also cross-listed with other archives. So they get a little bit more exposure than those that are only in ours. We're a relatively new archive, so it takes a little bit longer to build up that reputation. So again, this is it's a little bit misleading here. So I just wanted to provide that context. We can also look at things like how people are actually viewing different studies. And I realize the type is a little small here, but what you can see on the left in that kind of darker blue, those are the studies that actually have data. And then in the lighter blue, those are our metadata only studies. So a little bit more engagement with our studies with data, but again, and this is going to be over the last 3 months as well, which is why some of those numbers are a little bit lower. But again, quite a bit of engagement that we're starting to see with some of these studies. So thank you for sharing them with us. So I've talked kind of just broadly about the COVID Measures Archive, but I thought it would be nice to highlight a few different studies or data sources that we actually have in the COVID Measures Archive, and including some that are kind of coming down the pike here in the next few weeks to few months. So the first one is one that I've actually already mentioned, and this is the occupational social distancing indices. And so again, these were developed by Bruce Weinberg and Laura Montenovo, and they were derived from the ONET data. And they measure face-to-face and remote work capability by occupation as of 2019. And as you can imagine, as we've had many discussions around kind of the ability to do remote work, the effectiveness of COVID mitigation policies. This is really these are important measures to be able to assess when we're looking at COVID risk for different populations. As you can imagine, these are data that are available right now from SBE CCC, and you should definitely check them out. I also want to highlight essential work measures from PSID. And these were essentially, this is a metadata only deposit that we have compared to the data deposit that I just talked about. But the metadata and the code for creating these measures from the PSID data is available from ICPSR. And thank you to Emily Wiemers and her team at Syracuse for doing this important work. And specifically, this measures essential and frontline work history among PSID respondents and their spouses from 2018 to 2021. So again, providing some really important context for employment and occupation during the COVID-19 pandemic. So it's not just that we archive your data, we also try to highlight it and talk about and share the really incredible work that you do. And so these are flyers from just 2 webinars that our amazing Megan Chenoweth gave in the past year, exploring different types of data. But if you've ever run into us at conferences, we will probably talk your ear off about data. So there are many other ways that we're trying to get this out there and increase the visibility of the really important work that you guys are doing. So what's next for the COVID Measures Archive? So obviously we're going to continue adding more data and metadata. If you have things that you would like to share with us, please don't hesitate to reach out. We will also reach out to you directly, as some of you already know. And we've also started expanding beyond the consortium as well. And so a couple things that we're really excited about is we have these 2 that will be coming down the pike very soon. We have some data on the Supplemental Nutrition Assistance Program, or SNAP, and how that functioned during the COVID-19 pandemic. So we can provide you some additional data or information on that if you stop us over the next day or 2, but that should be coming pretty soon. And then also the COVID-19 US State Policy, or CUSP database. And this was put together by Julia Raifman and a group at Boston University, and was one of the main kind of policy databases, in addition to kind of the Oxford policy database and a few others like New York Times, that really were tracking COVID-19 mitigation policies, particularly in that first year or so of the pandemic in the US. As I mentioned, we're also really interested in, how the archive as it's currently set up is functioning, and does that match with kind of the intention that we had when we created it. And so what we've decided to do with this is do some kind of usability testing. And so what we're doing with this is kind of creating some, test scenarios on how we could imagine we would like the archive to be used, and actually have people go through this scenario and see what worked, what didn't work, what could be better, and what they actually really liked. So one example that we have here is, so say you're designing a survey questionnaire about the mental health impacts of COVID-19 pandemic on working age adults, and you're interested in respondents' experiences and diagnoses of anxiety and depression during COVID-19. How could you use the COVID Measures Archive to identify, existing survey measures that you could either adapt or basically borrow to make sure that your measures are harmonizable with, studies that are of interest to you. So we're kind of pulling together our list of people that we're going to reach out to for this usability testing. We might reach out to some of you guys. So, obviously we know you're busy, so if you can't do it, we're flexible. But just wanted to give you kind of a heads up that that's something we're actively working on. Okay. Next, we're going to talk a little bit about research outputs, so publications, presentations, and some dissemination of research findings. This was another thing that I was pretty blown away by when we started putting these slides together. So in the lighter blue on the left, we can see kind of years 1 through 3, and that biggest box represents journal articles. So as Jane mentioned, there were 36 peer-reviewed journal articles in the first 3 years. But if you look over on the dark blue in year 4, there were, I believe that actually, it's a typo, it's 29 peer-reviewed articles. So in the last year alone, you guys have almost matched the number that you had in the first 3 years of the study. And so I really think that's a pretty impressive, level of productivity. There's also been a number of preprints, research briefs, and even a book chapter. So again, the productivity, I think, of this consortium has been really, really impressive. There's been quite a bit of work at presenting at conferences. So we have a couple upcoming conferences that we wanted to highlight. So the Hung and Lee team has 2 presentations at Academy Health, as does the Joint Maddox team. At GSA in November, the Weimer's team has a presentation, and then at PAA we had an invited session, and there were presentations from the Weimer's team and the Camp Dush and Meyer team. Speaking of the invited session, I think it was, it was a little bit later, so we weren't at the 8 a.m. time slot again, which I think helped attendance a bit. And as you can see, we had 3 great speakers. We had Coulter Mitchell, Ilya Gutin, and Emily Wiemers. And you can see there on the right, the pictures of them kind of describing their groundbreaking science. And then you can see me telling probably a bad joke. So again, want to thank our presenters for that. I think it was a really interesting, and exciting to hear the incredible work that you guys are doing. So some of the ways that we've been trying to work on, I gotta speed up, okay. Trying to work on disseminating publications is through social media, our website. We have a team of librarians that kind of help manage our bibliography and write features about new papers, which I believe there's a slide on this actually next. And here you can kind of see a flyer for GSA that we put together last year. So as far as kind of the bibliography, you can go to our website, SBE CCC website, and you can see these kind of current events in the bib, which are these nice little write-ups from our librarian team about, the great research that you're doing. So again, just kind of another way to get that work out there to the broader community. One kind of new addition, and we talked a little bit about this last year, and now we're excited to actually have this in place and progressing, is working with our partners at CHART to develop issue briefs. And these are essentially one-page summaries of published research. And we definitely, modeled them closely after the amazing stuff that is done currently at Syracuse. So thank you, Shannon Monnet, for providing that nice example. So far, we've had 2 released, including from the NANDA group on some really interesting research related to comparing the SVI and the ADI. And another from Pei Hung on some of her work looking at telehealth. We have another one in progress, and we have 3 more planned for this year. So please let us know if you would like to be featured. Also, we will just reach out to you as well. So as far as capturing and communicating lessons learned from the consortium, we are drafting the white paper that we've kind of been in contact with you guys about. So thank you for really providing us such great information to kind of build that on. We are nearing the point where we'll be reaching back out to make sure that we're accurately and effectively representing your work. So there will be kind of a collaborative review process. And then we're also hoping that this can serve as kind of a basis for, potentially some more targeted commentary publications, as well as kind of serve as kind of another resource for this toolkit that is kind of under development at the Coordinating Center. Okay, speeding right along, I want to make sure to talk about our pilot grants. This is one of my favorite parts of this project. So this year we've had a lot of activity going on with pilots. We've had 7 pilot recipients from different years, some of whom had to request no-cost extensions for various reasons that are concluding their work this year. We had a really nice presentation from 3 of our pilot grantees in January talking about some really interesting and varied work that they were doing. There's a new pilot grant funded publication, some new data collections that are completed and ongoing. And this year, I'm excited to say we've awarded 4 additional pilot grants for a total of $210,000 this year. So, and who are those new pilot grant recipients? So we have one familiar face down in the bottom left, Chris Monk from the University of Michigan, who's a UO1 PI. But then the other 3 groups are brand new and from different universities. So we have researchers from the University of Wisconsin-Madison, University of South Carolina, and SUNY Downstate. So very excited, and I believe many of them are attending online, and we hope to see them in person next year. Okay, so I think I'm at just about at 1 minute, so I will speed through the last bit. Okay, so awards and accolades. So we've had some really impressive, this is not a complete list. So if you have, if you know of some that we've missed, please let us know. We're always happy to feature this kind of good news. But both Bruce Weinberg and our director and my co-PI, Maggie Levenstein, were named American Association for the Advancement of Science Fellows in April of this year. Pei Hung received the National Rural Health Association Research of the Year Award. And one of our pilot grantees, Rob Smith at CUNY, received the American Sociological Association Distinguished Career Award. So some really impressive awards just in the last few months and last year. Some bittersweet changes to the coordinating center. We've had a departure and have another departure that is soon to happen. Our co-investigator, the amazing Jim McNally, retired from ICPSR in February 2025, though I believe he's planning to come back as emeritus at some point, and you'll likely see him around at various conferences talking about aging. So do not hesitate to stop Jim. He's always good for a fun conversation. Also, our amazing project manager, Megan, has accepted another position within ICPSR and will be leaving SBE CCC here in May. So thank you for all of the hard work that you've been doing. Okay, so some other support that the coordinating center has been trying to do is obviously the post-annual meeting sharing of findings through the annual report that we complete with our partners at CHART. I'll say this once again, if you've not already let us know that you have embargoed material, please let us know. I'll also say that we have one of our partners from CHART, Holly, there in the back, if you can wave. So you'll probably see her around for the next day or so. But we'll be actively working on that as soon as the meeting wraps up. We are also, always here for consulting and technical support, and this includes our amazing survey methodologists, James Wagner and Brady West. We are at ICPSR, so if you have questions about data or metadata, archiving and sharing, please don't hesitate to contact us. And as Bruce and a few others know, I'm always happy to chat about infectious disease and epidemiology. So I'm only an email away, and we'll definitely put off some of the tasks that I have on my to-do list just to chat with you guys about infectious disease epidemiology. So, okay. I think I'm just about at time, so I will just close in saying that we're continuing kind of with the regular meeting cadence, that fourth Thursday of each month, with some meetings being kind of required business, and then, kind of interspersing in between with, webinars and presentations on original research. If you have grad students, postdocs, or work of your own that you'd like to share, please let us know. That's, I think, a great opportunity and something that we love to feature. We are also actively starting to plan already for the next annual meeting. Because of PAA changing their dates to early May, we're aiming probably more for March or April. If you guys have significant conflicts in those months, please let us know as soon as possible, and we will do our best to account for that. And we are also tentatively planning to have this kind of final meeting in our 5th year back in the DC metro area to kind of wrap things up where we started with our first in-person meeting. So with that, I don't know if we actually have time for questions. So I'll just say very quickly some acknowledgements. Thank you so much for our amazing funders at the National Institute on Aging and OBSSR. And thank you guys, because this is really not possible without you and the amazing work that you do. So do we have time for questions for Jane or I, or?
We could probably.
I don't want to shorten the break, so why don't, if you have questions for us, please just stop us, I think. Does that work for you, Jane? Okay. And if you come up with another question after today or after the meeting, again, please don't hesitate to email us. So thank you guys.